People can experience neck or back pain during or after participating in sports or working out. In some cases, this pain is the only sign that something is wrong. In others, leg and arm weakness and numbness may be associated with the pain. If working out or any type of physical activity is increasing your neck, arm, leg, and back pain, it's important to know the reasons why and when to consult a doctor. Most neck or back pain that occurs with exercise is usually muscular. This type of pain is typically self-limiting, goes away with a period of rest, ice, heat, massage, and possible use of over-the-counter anti-inflammatory medications. When pain associated with exercise becomes associated with radiating numbness, weakness, or pain going down the arms and legs, that's when we begin to be concerned about a structural problem with the disc that's injured and causing nerve compression. That's when someone should seek advice from their physician. Between every vertebrae in our spine, there is a disc that serves as a shock absorber. Activities such as running, jumping, twisting, playing basketball can send shocks up our spine with every move. This repetitive impact can cause intense pain if there's a diseased, torn, or herniated disc. Here we have an MRI of a patient that experienced severe pain after playing sports. We have the square-shaped vertebrae of the lumbar spine or the low back. We have the discs or the shock absorbers that are between the vertebrae of the spine. And we have the spinal cord and nerves that are traveling down the center part of the spinal canal. As you see, the disc between these two bones is bulging, and it has what we call a tear, which is shown by this bright signal here. If you enjoy being physically active and participating in sports and begin to experience neck or back pain that lasts longer than 2 or 3 weeks, it's a good idea to consult your doctor. If your symptoms become associated with leg or arm weakness and numbness, it's important to seek the consultation of a spine specialist.